Okay, this video is just going to be a list of mitochondrial inhibitors. It's really sort of an excerpt from my book here, my most recent book, Prevent and Reverse Atrial Fibrillation and CHF, AFib and CHF by me, Pete Rogers. The mitochondria are real important because you need energy. All your cells need energy. You know, MedCram guy, Dr. Roger Seaholt, real smart guy, he said basically if mitochondria don't work, nothing works. Okay. And by the way, Seaholt, he's got some good videos on sunshine, the benefits of sunshine, recently, as well as a whole bunch of other topics. Anyways, mitochondrial inhibitors. I became real interested in these because I knew sat-fat was causing diabetes by inhibiting the inner mitochondrial membrane. So I thought, gee, that's interesting. And I had once wanted to become a biochemist. So I went and through all my biochem books, I own like 7 biochem books, and there was not a single word, there's not a word on mitochondrial inhibition in all 7 of them. Whenever you don't see anything in all the common textbooks, that means it's being hidden from the medical students, the graduate students. So I decided to learn about it. I went through all the papers, I searched everywhere, and I ended up finding over 100 mitochondrial inhibitors, and many of them are very common. So people who've got a lot of common diseases, cancer, diabetes, lack of energy, chronic fatigue syndrome, just anxiety, insomnia, all of these things might benefit, probably will, from avoiding these mitochondrial inhibitors. Everybody would benefit from avoiding these toxic drugs that poison your energy production centers. Okay, metals tend to be mitochondrial toxic. Cadmium, you'll often find that in pasta, a lot of processed foods. Lead, mercury, that's in high fructose corn syrup quite often. It's in amalgams, dental amalgams. It's in a lot of fish, chromium, aluminum, it's in your tap water, okay, it's in deodorants. Arsenic, antimony, iron. Most men are iron overloaded in Western countries after age 25, most women after about age 55. Excess zinc when they stop menstruating. Zinc, excess copper, excess manganese like welders, excess nickel, you can sometimes get that from implants, excess silver. Fluorides in your tap water. It's in most toothpaste. You don't want any exposure to it. You want to remove that from your water with a water filter. Okay, I'm showing you all these so that if you're sick or just if you want to optimize your health, you want to optimize your athletic performance, your academic performance, you avoid all these. Herbicides like glyphosate and atrazine. That's why I'll only eat organic food. They spray glyphosate on like about at least 70 different types of foods. I made a video about that. Glyphosate sprayed on 70 foods. Rotenone, paraquat, mold inhibitors. Mold inhibitors typically are succinate dehydrogenase inhibitors. That's complex 2 of inner mitochondrial membrane for electron transport. Lots of estrogenics are mitochondrial inhibitors, especially atrazine, bisphenol A, other bisphenols likely, some plastics, sort of BPA, also the phthalates. Non-stick cookware, you don't want to be using that stuff. POFA, the canary in the kitchen will get real sick. That's the canary in the coal mine for you. Saturated fat, we talked about that. Omega-6 cooking oils will produce toxic aldehydes called hydroxynonenal, H and E, that are toxic to mitochondria. Titanium dioxide in a lot of medications. Some of these frank poisons like MPTP, that's they try to make an opioid and it causes Parkinson's disease. Trichloroethylene, that's why I don't go to dry cleaners anymore because they use those chemicals. A lot of cleaning products will use that. Liquid paper uses that. Flame retardants. I won't wear the blue medical gowns unless I have to. Like if I'm doing a minor medical procedure, debriding a wound, just doing some case where I don't need to wear the blue, then I won't wear the blue. The blue gowns are for the operating room where you're going to be using cautery and there's a risk of fire. Okay, but if you're just doing some minor procedure, you don't need to wear the blue bromine flame retardant gowns and get that crap on yourself. Cyanide's a mitochondrial inhibitor, and that's another reason why I'll never take cyanocobalamin. I think it's stupid. People say, well, the amount of cyanide in cyanocobalamin B12 and flax and almonds, it's so small, it doesn't really matter. You know what? I don't want any. If I can avoid it, I'll avoid it. And you don't want to chew on apple seeds or cherry pits or elderberries. They all can contain cyanide. And that preservative apiol that they put on avocados and some other fruits, it's also called Edapil or Ganapil, that can contain really bad potential contaminants, including toluene, hexane, Those are both major neurotoxins, and lead, major neurotoxin. And acetonitrile, which is like methyl cyanide. You don't want that stuff. Bad, bad, bad. Okay, here's more mitochondria inhibitors. Let me shrink myself here. Okay, stimulants, nicotine, caffeine, vasoconstrictor, excitotoxin stresses mitochondria because it overloads them with work. So what happens is the mitochondria needs to produce ATP. It typically produces over the 90% of the ATP of a cell. And if you can't make enough ATP to keep up with the calcium entry into the cytoplasm, that cell's at risk for apoptosis to die. Alcohol, methamphetamine, cocaine, ecstasy, marijuana-related compounds, THC, CBD, and this other spice stuff. Mountain mining, particulates, air pollution, welding material, inhaling welding material, that's dangerous. Traumatic brain injury, inhibits pyruvate dehydrogenase enzyme. Selective serotonin reuptake inhibitors, these antidepressants, things like Lexapro, Prozac, Trazodone, sertraline. SNRIs like tramadol, tricyclic antidepressants, amitriptyline, antipsychotics, Haldol, chlorpromazine, clozapine, risperidone, etc. All psych meds are bad. All psych meds cause a gradual or a fast lobotomy. The antipsychotics tend to cause it fast. The other drugs tend to cause it slow. They're major frickin' toxins. Okay, oral diabetes medications, metformin, mitochondria inhibitor, great, like about the most common diabetes medication. And also these PPAR alpha agonists, the fibrates. I would avoid all that stuff. Antihypertension, beta blockers, propranolol, metoprolol, atenolol, all of them, carvedilol, timolol, yikes. Some of these diuretics, hydrochlorothiazide, some of this hair stuff, minoxidil. Plus I've heard a lot of bad things about finasteride. I would never take any of that stuff. Really bad stuff. ACE inhibitors, hydralazine, diuretics. Diuretics also can mess up your electrolytes, can make you low in magnesium, for example. Hydrochlorothiazide, Lasix, furosemide, antibiotics, tetracyclines, fluoroquinolones, aminoglycoside, beta-lactams. It's a lot of stuff. General anesthetics. I'm scared of general anesthetics, man. I worry. Will your memory come back to normal? I've never had major surgery. I don't want to ever have it. I'm going to do everything I can to avoid it. Analgesics like propofol, the patient's been sedated in the ICU for a week. He wakes up, he's not mentally normal. Well, maybe it's because the anesthetic was damaging to his mitochondria. It's not necessarily because of his baseline disease. Tylenol, it's a common medicine. NSAIDs, non-steroidal anti-inflammatory drugs. Anticonvulsants, they slow down the brain to prevent seizures, but they also slow down the IQ. Antiplatelets, aspirin, Plavix, rivaroxaban, Xarelto. Antiarrhythmics, amiodarone, lidocaine, quinidine, adenosine, digitalis. It's a lot of stuff. Chemo, tons of chemo drugs. Chemos, man, they're like major poisons. Okay, I'm just saying. So I figured this all out. I'm the one who looked it up, I'll never get credit in a regular journal. I'll never get credit in a textbook. So I'll give myself credit. I figured this all out. I looked up all these mitochondria inhibitors. There was nothing in any of the textbooks. And I know some PhDs would individually figure out that they caused problems, but the PhDs can't put stuff together. They don't know enough, okay? They don't know toxicology, molecular biology, biochemistry. They just know their little narrow area. And so these things are major contributors to all these diseases, and they're easy to avoid once you understand them. And so I'm just doing what I think needs to be done. Somebody needs to do exactly what I'm doing, is teach the public about how they can make themselves healthy and avoid all these poisons that no one else is going to teach them about. So like I said, I'm like Thomas Aquinas and Aristotle, unifier of faith and reason, trying to classify the useful current information to educate people, to make the world a better place. And this is the situation we're stuck in, All right, so anyways, I hope you found that helpful.